deliver a package to the household, engaging the household to verify the needs they need.
NAMA Wellness, in conjunction with the Health Department and other partners, have worked hard, and this has led to a significant improvement on the level of health indices, with Mukono district being in category 1 as far as immunization is concerned. And category 1 means a district is both having good accessibility of their immunization services, and the people who access those services stay in there until a child completes their schedule. So that is under red categorization of immunization, which is reaching every district and every child and woman of childbearing age with immunization services.
They have gone ahead to see the needs in the hard-to-reach areas, and they have given a hand. So services like for HIV/AIDS, family planning, cancer screening, prostate, adolescent girls services, VHT support. I have had a sort of VHTs here, and so the first time I've had this.
NAMA Community Wellness Center, from the observations I've made, is committed to strengthening health systems. I've read a number of reports that NAMA has shared with partners in Uganda, and I realized that NAMA Wellness is contributing a lot.
Our nutrition and family planning and mental health programs has also not been left out, and these have brought about remarkable change in the community. We had the VHTs, and also in the presentation how people have benefited from that. Our former Director General of Health said that, I quote, "Health is made at home and it is repaired in the hospital." So NAMA is repairing our people, making our people healthy.
I want to first appreciate the work which you do. I have been following. I think I've interacted with NAMA for a number of times. There is a time when I came and opened a training course for a number of health workers. So we operate in the background. Yes, we live with the Department of Community Health, the Department of Health Promotion, but at least we're aware of what was happening. So you've been really supporting VHTs. Your focus is in women and children, but I also want also to add that don't forget us, even as the men. So because we are part and parcel of this family, sometimes we forget the boy child, and you know the harm which the boy child can do, can cause the girl child. And that's actually why we're saying that a lot of teenage pregnancies, which came up with COVID, a lot of STIs, a lot of HIV. So we need to be able to look at that aspect. So I was reading the story how NAM was formed, and I think you initially, when you started, it was mainly you started at education, but you saw that without health, definitely you couldn't be able to achieve all the other things. But I think we need to work with all the other sectors in terms of a multi-sectoral approach, and be able to see how we can keep the girl child in school, be able to address that. The other aspect which I am quite very passionate about is the aspect how we can be able to work with NAM to be able to advance the aspect of self-care. And self-care is just the work which we have been doing to see how do we empower communities. So if you look at women, which you're already doing, you're empowering them by giving them self-injection of cyanopress. We're looking at how can we be able to empower them by doing self-tests for HIV. We're probably looking at how can they do self-sampling for cancer of the what? Because I am sure many ladies fear to be examined, and that's where we are seeing that most times they present with cancer of the cervix when it's late. And we will be able to see that these are all preventable. I'm told today the day is for celebration, so it's not day for talking. So I want to bring this to an end, and once again congratulate all those ones who put their hands their energies, their efforts. I think the Father prayed here very well so that we can see that NAM grows and continues to grow and grow. Thank you very much for listening.
7, 6, 5, 4, 3, 2, yes, 2025. Yes, yes.
Oh yeah! Thank you.